Welcome, welcome. Just waiting as everyone comes in. Thank you for being here this evening. We will be beginning shortly. If you have any questions as you enter, please feel free to use the chat box. And we will begin at 4 p.m. Welcome for those of you who are joining us. We will begin in about 1 minute. Well, welcome again. Thank you all for joining us this evening/afternoon as we talk about underage drinking prevention. My name is Nikita Howell, and I am the Underage Drinking Prevention Coordinator at Guide. And we are just thankful that you all have taken the time out of your schedules to discuss a very important topic that we believe that everyone should be aware of and be prepared to just learn more about this evening. So today we have a group of experts that will provide insight on why underage drinking prevention is still an issue and what we can do about it. So first of all, this webinar is being recorded so that you can share it or come back and rewatch it at a later time. If you have any questions throughout this training, I keep saying training, but throughout this webinar, if you have any questions throughout this webinar, please feel free to use the Q&A box at the bottom, and we will get to them during our Q&A portion of the program. So at this time, I'd like to ask for our panelists to introduce themselves. And let's start with Charmaine.
afternoon, everyone. My name is Charmaine Brown. I am the founder and CEO of Jared's Heart of Success, a youth mentoring and leadership development program in Stone Mountain, Georgia.
Alexandra.
Good afternoon, everyone. I hope you all are doing well. My name is Alexandria Hurt, and I'm a regional prevention specialist with Georgia's Department of Behavioral Health and Developmental Disabilities.
Amara.
Hi, good afternoon. My name is Amara Jackson. I am a member of Guide's Youth Advisory Board, and I advocate for drug and use prevention for teenagers.
And Ellen.
Good afternoon, everyone. I am Ellen Gerstein, the director of the Gwinnett Coalition for Health and Human Services. I am also a member of the Guide Board of Directors and have been in this prevention field for 30 or more years, not to age myself. And you'll be hearing more from me later.
Yes, we cannot wait. And last but not least, Michael.
Hello, everyone. My name is Michael Davis, and I am the Associate Executive Director for Prevention at Guide. So my job is to work with all of our coordinators that work on our prevention work and help them create change here in the Gwinnett community.
Jessica, did you want to introduce yourself? I wasn't sure.
I can. Hi, I am Jessica Andrews Wilson. I am the Executive Director at Guide, and just want to say thank you all for joining us, and thank you to all of our panelists for being here with us tonight.
Thank you. And so just to give you an overview of how this webinar will flow, we will start with a presentation from Ellen, and she'll give us a framework on why underage drinking prevention is important and kind of give us some background on the history of underage drinking prevention. After that, you will have the opportunity to hear from each of our panelists as they answer specific questions that we have put together to give you an understanding of the work that each of them are doing. After that portion of our program, we will have a Q&A portion. So if you have any questions during any time, please use the Q&A box, and we will try to get to as many of our questions as we can. So at this time, I'd like to hear from you, Ellen. We want to thank you for being here this evening and giving us the information as far as the history of underage drinking prevention.
So there is a lot of history, and they only gave me a few minutes to go over it. So of course, I can't speak of all the history of underage drinking and why it's important in Gwinnett and for Georgia as well as our country, but I'm going to try and do my best. So if you can go to the next slide. So just to give you a little bit of an overview about how this all got started, Guide has been around in Gwinnett for over 30 years, and they have been working on all kinds of substance abuse prevention. The coalition was formed 30 years ago, and when we met each other, we knew instantly that we had a lot in common and needed to address underage drinking, other substance abuse issues, because a lot of these issues are hidden and they're not as sexy, so to speak, to address, like maybe teenage pregnancy or some other type of homelessness issue. So we decided that in Gwinnett County, they have been doing some pride surveys forever. And they had been measuring underage drinking, and actually one of the measurements was the use. Have you ever used alcohol among our teens? And it had remained a very steady number. For many years, it was about 52%, which is concerning. However, they started to see this increase, and we started to see this increase. And it got up to 59% back in 1995 when we created the first comprehensive youth health survey in Gwinnett County. Before the school system started doing the survey that you're all familiar with, the coalition came up with our own survey because we never had a comprehensive picture of substance abuse prevention and other risk behaviors in Gwinnett County, as well as wanted to see across the county what these behaviors were. They may have measured it countywide, like in the Pride survey, but we knew that we had different communities that may have had different problems. So we were able to develop this survey along with the University of Georgia and lots of stakeholders. And as I told you, we saw an all-time high of use at 59%. The good news is that when a community comes together and targets their resources and collaborates to address something, we see progress. And you can see when we measured again in 2006, 39.7% of high school students in Gwinnett reported they had ever used. Now, unfortunately, this is not a measurement that is being measured anymore. So in 2017, 10% of high schoolers in Gwinnett reported they had ever used in the past month. I can't report what that is. They did away with that. It's now 30-day use. But just to show you what significant progress we made from 59% of high schoolers down to 10%. Next slide, please. So here's the 30-day use I was telling you about that is being currently measured. And you can also see that a lot of progress has been made on this. So just going back a few years, you can see that in high school in 2013, significant declines had already been registered from those high numbers I was telling you about before. But it is down now in 2020 to 9.7%. Yay, us. A lot of community work goes into this. Okay, go again. So just to show you, 12th graders have a higher amount of use. I'd like to also look at 12th grade use. These are children who are getting older, but we do not feel should be drinking. They're not of age. It's still affecting their bodies and their minds. And we are, go back. So you can see we're making progress on this as well. 2020, it's down to 13%. All right, go to the next slide. So one of the really interesting things that has occurred over my career in doing this business is a lot of research has been conducted about the effects of alcohol on the teenage brain. And why this is really important is that it's very difficult to work on prevention. It's very hard to show how does prevention really impact the. It also is very difficult to reach parents and others in the community that this is a problem. And a lot of denial goes into this, as well as it's not my child, or maybe it's not that bad. I drank when I was younger, or it's a rite of passage. It's not going to hurt them. Well, this is a game changer, the research on the teenage brain. So go to the next slide. There's great resources on this, and Guide has great resources if any of y'all have not seen this information. But the parts of the brain that are affected by this, it's amazing. It affects the frontal lobe, it affects the hippocampus, the hypothalamus, the cerebellum, the spinal cord. Every aspect of the brain in a teenage brain is still growing and developing. And you put a substance on top of that, like alcohol or marijuana or any substance, the research is showing it has profound impact on the teenage brain. So as a parent, if you think it's not so bad because they're taking a drink or it's a rite of passage and it didn't affect you, it did affect you. And it's affecting your children. And a lot of research has gone into this. We've done some really cool analysis in our surveys about what happens to kids when they drink. And that's for another day and time. So go to the next one. This just gives you some really high points of this. So the frontal controls your rational decision making. It's the last part. It's right here. It's the last part to mature. Why kids behave the way they do. This is it. It all has to do with the frontal lobe. It has to do with your emotions. It has to do with your decision making, your risk taking, that kind of thing. You drink, it retards the growth of the frontal lobe. The hippocampus is about learning and memory. And if it's damaged by alcohol, it really impairs your learning and your memory. Alcohol increases stress, your ability to manage it, and of course, you can be poisoned and overdose very easily. To the next slide. So we got a grant through the coalition, through our drug-free community grant, which is one of the things that has really helped us address underage drinking, because it gave us some extra resources that we really could focus on some environmental strategies and some tried and true evidence-based practice that has shown that if you do these types of interventions, that it will significantly make an impact on your community. Like I said before, prevention is a hard thing to prove that it works. So there's been a lot of research into this. So we're addressing underage alcohol and sales. Our youth action teams, which you're gonna hear from in a minute, have been working very hard on addressing it from a peer perspective, as well as we've been doing some parental work in addressing their perspectives on things and how, as a community, you can really change the social impact that it has on your community. All right, go to the next one. So, like I said, we're focusing on social and retail access, promoting norms that underage drinking is unacceptable, and providing opportunities for youth in leadership and service. Next one. So here are the evidence-based programs that we've been working on that we highly recommend and could help any of you if you're interested in learning more about these. Compliance checks, parent social norms campaign, peer-focused social norms campaigns, and commercial signage campaigns. And I can talk a little bit more about this in the question and answers. The only other thing I want to say, the data that I didn't mention, is about, even though we have seen quite a lot and significant progress in reducing underage drinking in Gwinnett County, we're still very concerned about underage drinking. It still remains the top drug of choice. Marijuana is catching up, unfortunately. However, the amount of drinking that does occur by youth who drink is even more concerning and has been on the increase. And we call that binge drinking. And over 50% of the youth who say that they use alcohol in the last 30-day binge drink. And that's having 5 or more drinks in a row. So kids are not drinking because they go outside and need something to cool off with. They're drinking to get drunk, and that is not good behavior. So thank you.
Thank you, Ellen, for that presentation. I think you really drove home why alcohol is still important. I think sometimes in the media, these other substances kind of overshadow alcohol. So thank you for showing us why this is still an issue and why it should be important to all of us. So at this time, we will start the Q&A portion of the program. We have a few questions that we'd like the panelists to answer, and then we will open the floor to questions from everyone. You can go there. So our first question is, how is the state government addressing underage drinking prevention?
Okay, so that will be for me. Hello again, everyone. Once again, my name is Alexandria Hurt. And like I mentioned before, I'm actually a regional prevention specialist currently with DBH DD. And within DBH DD, I work within the Office of Behavioral Health and Health Prevention and Federal Grants. And in this division, I currently work on a project that is called ASAP. And that is Alcohol and Substance Abuse Prevention Project. And ASAP currently works within 38 communities within the 6 regions of Georgia. And we work with, the way we refer to them as providers, but they're essentially known as communities. And within these communities of providers, they're skillfully trained to work on the strategic prevention framework, also preferred as SPIF. And in those communities, they're working on different initiatives within different coalitions and different programs where they're working to combat teen underage alcohol use and also other substances that are identified in those communities, but especially alcohol abuse. And with ASAP, there are other initiatives that are here in Georgia that are working with teen underage drinking. Also affiliated with GUIDE, they have the Georgia Teen Institute, which is also referred to as GTI. And GTI actually has a 4-day residential camp where they're working with teens and they're helping them to learn different leadership skills, they're also pulling tactics from the SPIF and helping them to learn different leadership skills and talking about prevention and ways to work with prevention within their age group. And then after their 4-day camp, they're going back into their respective communities and still having the support of their mentors and everyone that may have trained them. They're going into their respective communities and they're using the skills they've learned. They're helping, they're helping their other peers to learn different things. And studies have shown that this is a great way to combat any type of substance abuse when you have peer-to-peer mentoring. Another affiliate group within Georgia is also actually affiliated with Emory University, and it's the Maternal Substance Abuse Program. And this deals with understanding how alcohol is affecting pregnancy and mothers, and of course, teen pregnancy is an issue that is addressed within this initiative, and that's how they're able to address teens in that program. Another statewide initiative is actually the clubhouses that are in Georgia. And within these, there's actually 3 clubhouses, and they're located in Norcross, Georgia, Dawson, Georgia, and LaGrange. And within these clubhouses, it's actually like a drop-in situation. And within the clubhouses, they have different mentoring, teaching skills about nutrition, different family activities, different workshops that help the teens. And I think the ages within these workshops usually is from 11 to 17. And they're trying to help them to learn different ways to combat and different issues that deal with prevention. And the teens that are coming to these clubhouses more than likely are at a higher risk, whether they have parents or siblings or people close to them that have alcohol or other substance abuse issues. And then another program that I'll mention is V4P, Voices for Prevention. And something that they work with is alcohol prevention and also suicide prevention. And they have different initiatives like hosting an annual substance abuse observance day that brings different issues to light that ties in and deals with teens that may be affected with substance abuse usage and dealing with alcohol prevention.
Thank you. It sounds like there's a lot of work being done across the state, and sounds like a lot of opportunities to get engaging communities in this work. So
Yes.
here in Gwinnett County, what organizations are working to address underage drinking, and how long has this work been done?
Is that my question? Okay, so we've been doing this work for, whew, well, since the DFC started, that was in 2007. But previous to that, Guide and the Coalition have been collaborating early 1990s. However, when we got the grant, like I said, we were able to really concentrate a lot of the work, as well as the impetus was the comprehensive use survey. That the first time we did that survey was in 1995. We have a lot of partners in Gwinnett County. One of our biggest partners is Gwinnett Public Schools, Gwinnett County Parks and Recreation. If you drive around to any of the parks in Gwinnett County, you will see evidence of our Norms campaign. We have these big banners that are up on the fences or in other areas in different languages all across Gwinnett. It is fascinating. If you haven't seen them, you need to see them. They're amazing. And talking to parents about they're the reason why kids aren't drinking, and there's some data on there. Our Gwinnett County licensing has helped us with some strategies for our liquor licensing and such. The cities, we work very closely with the cities in Gwinnett County. The city of Duluth has been an amazing partner for us and has done everything possible that you can do to really address underage drinking in the city, as well as Snellville and Lilburn are great city partners. We're always looking to expand our city partners. The Youth Advisory Board that you're going to hear from is an amazing partner of students around Gwinnett County who work diligently in addressing this issue from a student perspective. We have a great partner with our media, our Gwinnett Daily Post, which is our local newspaper. Been amazing over the years and has put in lots of information to help us educate the public. We're getting ready to produce some new materials as we speak to put out to the public. Some of it they do for free, some of it is low cost and using our grant dollars that way. We have a lot of local retail outlets that we partner with and do different campaigns for the norming work as well as the compliance checks, as well as sticker shock campaigns. We've got great parent participation in a program that we've implemented through Parents Who Host the Most. We found in our surveys that a lot of youth get their alcohol from their parents or other adults, and we needed to target that. A lot of people have the perception that youth get alcohol from retail, and some do, but not the majority. The majority are getting it at home or at a friend's home. And so it's very important that we target that and educate our parents about that. So that's some of the partners that we have. There's a lot. We really have been fortunate to have wonderful relationship and partners in Gwinnett County.
Thank you, Ellen. Often we talk about the issues that affect our youth, but rarely do we take the time to speak to our youth about their experiences. So Amara, could you tell us what alcohol usage looks like in our schools?
Okay, so hi again, my name is Amara Jackson. And as an upcoming high school senior, I've seen about 6 years of mental and physical issues that have been demonstrated in students in both middle school and high school. So as a student currently residing at Archer High School, which is in Gwinnett County, I experience peer pressure every time I'm inside the classroom, from something as simple as moving closer to my friends because I want to talk to them and engage in conversation when I shouldn't be, to just cheating on a test, which you shouldn't do. Moreover, one action that has been damaging students throughout the world in the classroom is the peer pressure to consume alcohol and drugs. And yes, even in Gwinnett County, many parents are not aware whether their students are affiliating themselves with peers that use or whether they're using themselves. As of 2019, Grayson High School, my school's rival in sports, has the highest percentage among its students in all of Gwinnett County schools that use. 7.8% of them reported that they use once out of 30 days, with 4.2 of that 8% using more than 20 days. And yeah, I did say 20 out of 30 days, that it's very scary. Students in high school who use often equate popularity with giving into the peer pressure of using alcohol and drugs. However, for me, it's quite the opposite. As a member of GUIDE's Youth Advisory Board, I believe that using drugs and alcohol diminish your motor skills as well as your mental and physical health, especially at the young age that I'm at. The brain of a teenager is not fully developed at the age of middle and high school, so consuming only impedes the education you need to be successful in certain aspects of your life. From driving to finding a job to performing in school, all things that require a clean bill of health, going from any age to college and to adulthood. However, students and parents must understand that all students do not use. I'm one of them. I'm an example of someone that chooses not to use for several reasons. In fact, in a survey given by GCPS personnel every year to both middle school and high school students, 90% report that they have never used drugs or alcohol. And this is given every year. And that's actually a pretty good amount of students. However, we also know that students lie. They are not always honest with their answers. However, the majority of students will generally answer that question honestly and say, yes, I can't use. And this goes into something that I learned this past week called developing your no. One thing that we have to understand is when you believe in something, you have to strongly stand firm on that. And being a high school student, I'm still at that age where I'm trying to find myself. But I do know there's one thing I will never try and engage in, and that is using drugs and alcohol. The reason I stay drug and alcohol free is because I want to stay committed to my family, my friends, to being there for the people that I love the most. And that's very hard when you start to engage in something that can damage your brain, your physicality. It can very badly, you're just hurting yourself at such a young age. So I think it's very important for me to just keep myself healthy, keep myself educated and in school, because it also impacts your grades. I know several students, several friends that have had to drop out because them consuming alcohol and drugs on a daily basis was impacting their grades. They ended up failing. And when parents find out about that stuff, it's very bad for you, as well as just bad for your health at that point, because you are using every day. So I think it's very important for students to kind of take the time to realize, hey, I need to develop some form of no if I strongly believe that this is not something that I want to engage in. I don't want to use, I don't want to do anything that can harm my body or impact my GPA, something that I need to be successful going into college, going into adulthood, because that also impacts your jobs. what things look into you when you're trying to get a career and be successful in life. So yeah, that's pretty much all I have.
Thank you so much for that, Amara. I would just say that I am personally glad that you are a part of our youth advisory board, because it is, you just within your answer to that question has shown that you are a leader in your school and your community. So thank you for providing that perspective. So it is clear that alcohol usage is still an issue for our youth. I think in some ways it's become normalized to put our youth at risk for adverse outcomes. So, but some of those first steps in underage drinking prevention start at home. So Charmaine, what do parents need to know or look for when it comes to underage drinking?
Okay. When I'm speaking to teens, I normally ask the question, why do so many young people drink? And when I pull the room, they list the first as being peer pressure, increased independence or the desire for it. Stress is another area, and then availability of easy access. Some even stated that they got it from family members or even found it at home. So one of our preventative programs at Jared's Heart of Success is with our youth action team. We use several approaches that we found to be very successful. The first was the individual level intervention, and that approach seeks to change the way young people think about alcohol so that they are better able to resist the pressures to drink. Another, within our program, we provide students with the knowledge, skills, motivation, and an opportunity to remain alcohol free. And then we empower the parents so that they'll be able to set and enforce clear rules against drinking. We know that communication is key, and as well as ways to improve communication with their children about alcohol is most important. As a parent, I know firsthand that parents, we can be either a positive or a negative influence in our kids and whatever their decisions may be, especially when it comes to underage drinking. So what I would say for parents is that we have to definitely create a foundation, a safe foundation for our kids, and we must have the talk. We must have that talk with them. We need to talk to them about the dangers of drinking. And then again, like I said, serve as a positive role model. Make sure that that alcohol is not available in the homes. We need to get to know their friends. We must know who our friends are hanging out with. And then we have to have regular conversations with them just about life in general. We need to know their thoughts. And then we also need to supervise. If there's parties, if we allow our children to have parties at home, we must supervise the parties to make sure that no one is bringing alcohol in the home and that we don't have it there available as well. We must also encourage our kids to participate in healthy and fun activities. You know, other things that do not involve alcohol. Again, we know that research shows that children whose parents are actively involved in their children's lives, that they are less likely to drink. And so we have to be, you know, very connected and look for warning signs. There are warning signs that we need to be looking out for as parents, like changes in their mood, academic and behavioral problems that could arrive at school or at home, you know, rebelliousness, change in your group of friends. Another is low energy level problems, concentrating and remembering things, and then slurred speech. So as parents, we have to just, you know, continue to be on the lookout for those things. And then lastly, I would say that if we find that our children have participated and have been engaged and that it's a serious problem, make sure that we get help for them. Seek help. Make sure we speak with a counselor, a psychologist, psychiatrist. Just make sure we just don't sit and let it go unnoticed or sweep it under the rug. We must do something about it immediately.
Thank you, Charmaine. I love the examples and the real life examples that I believe any parent that is live with us today or is watching this recording can really use in their homes with their children. So while underage drinking prevention is being addressed at home, some strategies do exist within communities to keep alcohol out of the hands of minors. So Michael, what solutions are having the biggest impact?
Thank you for the question, Nikita. I think we're seeing a lot of solutions coming together, and I think anything that we want to do, we want to make sure we're having a multi-pronged approach. So I think from what Amara and Ellen and Alexandria and Charmaine have all said shows kind of what a multi-pronged approach looks like. So when we see looking at alcohol, taking it out of the hands of minors, our compliance checks are doing their job. They are showing differences in there. And we see over the time, and Ellen kind of noted that we work with Gwinnett County Police Department to do compliance checks with the city of Lilburn, city of Snellville, city of Lawrenceville, and city of Duluth. And we've seen over time these numbers rise of how many alcohol providers are actually in compliance. And that makes us happy. That is showing that when they are being tested, they are not selling to our youth. So we give out window clings that say, we do not serve to minors. And our new window clings that are going to go out are going to say, thank you for not serving to minors, or we did not serve to minors in 2020, or whatever that looks like. And so we can start rewarding our partners for that. So if you see those in your retail shops, in your stores, in your restaurants, thank them for putting that up, because that message to a youth says, don't even try it here, right? We're not going to sell to you, so don't even try it. So thank them for having those window clings up in your community. When we're looking at the parents and looking at parents, as Ms. Charmaine had talked about, looking at different initiatives to get them engaged. One great way that we see is our friends at Decatur Prevention Initiative, DPI, and their parent network that they have already established, where parents sign up and say, I will not serve alcohol to minors in my house. And so as Ms. Charmaine saying, in Decatur, a parent can say, well, are you going to go over to so-and-so's house? Well, let me see if they're on this network with me. Oh, they are. I know I can send you, and I know you're being monitored, right? Because we've agreed by being in this network together that we're not going to give that to our youth. So finding those locally owned places that make it work. So if you're in smaller communities, that's a great way to get your parents connected, to engage them. In Gwinnett, we're throwing out those parents that host that Ellen talked about, and trying to get that out of helping parents understand. And our Positive Social Norms campaign is parents are the #1 reason youth report not drinking. When we ask youth, why do you choose not to use alcohol? They constantly come back and say parents. When we ask parents why your youth choose not to use alcohol, they will say peers. They will say everything but them. So we want them to know that their power is great in that time, right? And then often the skills-based, teaching those resiliency skills, teaching those coping skills, teaching those skills, because we remember that alcohol is not the problem, it's oftentimes a solution to a deeper problem. So why did our youth decide, as Ms. Charmaine said, that they need to go to alcohol? Is it the stress? Well, how do we teach them stress management techniques, right? So they don't go to alcohol. So looking at that. And the last thing that Amara talked about, being a part of the Youth Advisory Board and our youth action teams across the state of Georgia, planning projects for their peers. Because I can plan, all of us adults can plan, Lexi can plan, from the state side of thing, Alexandria can plan from the state side of thing. But if the peers are doing it for themselves, we know we hit the message in the communities that they want. We know the peer-to-peer intervention techniques are the most effective. They're the best campaigns out there, and they're more relevant and do better work than sometimes all of us on the outside. We are there to put the structure in place so the youth can do their job helping each other say no to drugs and alcohol.
Thank you, Michael, for just giving us that overview of all the things that we are doing, or that our communities are doing, that is making a big impact. So as we've heard this afternoon, there's a lot to be aware of regarding the dangers of the issues around underage drinking prevention. So this question is for everyone. And so from your perspective, what is the biggest challenge to addressing this issue? So if each of you could answer this 1 to 2 minutes each, feel free to unmute yourself and let us know what you believe is the biggest challenge of underage drinking prevention work. Okay, Alexandria.
I'll go. I would say from just talking with some of my providers and just from everyday life stuff that I've seen when I've volunteered with teens and stuff, I think one of the major reasons why alcohol prevention can be very difficult is because it is a legal substance at the end of the day. And I feel when I've talked to other teens, you know, obviously there are other substances that are being abused, but it's harder to get their hands on those other substances versus alcohol. Like people have mentioned earlier, it's in their homes. They may see their parents drinking it socially very often. They have friends that are bringing it to different places. So, and also I feel because of, you know, it's legal and then the representation of it in the media, I do think a lot of teens that may not have parents at home talking to them about the dangers of alcoholism, they think it's okay, they think it's cool. So I think the fact that it is legal makes it very, very difficult for people, public health professionals like everyone here that are trying to combat it and trying to work at it because it's just so easy for them to access it. And I just don't see I don't see a lot of entities making certain changes that we are trying to make anytime soon. So I think that makes it very, very difficult, the fact that it's legal.
Awesome. Did anyone else want to share their perspective? Okay, Ellen.
It is so readily available, and it is seen, as I said before, as a rite of passage. There's a lot of controversy about the age. When talking to parents, it's like, you know, you hear the excuse, well, if my son can go to the military, why can't he drink? If they're mature enough to do that, they should be able to have a drink of alcohol. And some of that makes sense to you as a parent or as a, you know, person of logical thinking until you look at the brain research. That has really been a game changer for us so that we can really show the community that the effects, even though you don't think it's bad, research shows that it is bad. And trying to get that information out is so difficult. In Gwinnett County, we have almost 1 million people. We have the largest school system in the state and one of the largest in the country. And so just getting the word out to people and having to pay attention to this as an important health issue is almost overwhelming. I've spent 30 years of my career on this, and even though we've seen a big difference in doing it, it's been a lot of concentration, a lot of resources. I'm concerned that if the resources aren't available in the future, that we'll go backwards, because you have to stay on top of this all the time, or like Alexandra, it's the next issue. You know, marijuana is in the news all the time, and so that's what people are paying attention to. But we know that this is the drug of choice for youth, and so it'll get forgotten and rates will go back up. And if they go back up to 59%, I'm going to have a heart attack. So that's it.
And I would just echo what everyone else said earlier. And then again, not having that conversation and not having a talk, and just a lack of communication around the subject. And most people are just not knowing that alcohol is the most widely used substance, you know, abuse among our youth. We just got to have the conversation. We have to talk to our youth and keep them actively engaged in, you know, in this prevention effort. So.
I will jump in and kind of echo what a couple of people have said. I think also looking at when we were at 59, the parents, those are the people that are parents now. So if they did it when they were a teenager, why isn't it okay for their teenager to do it? So I think that addresses to Ellen on there. And I think we also have to look at whether we want to admit it or not, the alcohol lobby is very strong. The alcohol lobby has a huge grasp on what's happening in the policies that are made. And the fact that we raised the drinking age to 21 behind in research, that's why I got raised, was a huge hit, but the alcohol lobby still is there. And if you still look in the state of Georgia, our alcohol tax is still one of the lowest in the country for any other state. And so I think it's just about convincing people to change and winning them over. And people want to talk about the negative effects. So they want to talk about don't drink and drive, don't do this, don't do that, but they don't want to say the problem is alcohol. You can't drink and drive if you don't have the alcohol, if you weren't overserved. And I think that is a huge thing that we look at. We look at the side effects and we don't look at what is the cause on that. And so I think that's what makes this conversation hard with that. And as kids, we see our parents drinking are oftentimes, and we're not having conversations about here's why mom and dad or mom and mom or dad and dad or whoever can drink, because we're of a certain age, our brain is developed, and we do it responsibly by doing this, this, and this, right? We do it responsibly by having a glass of wine at dinner and that's it, or we make sure we never drive when we do this, and start having those norming conversations around alcohol. And that's not what's happening all the time. People are still, I think one of the statistics out there is that 90% of alcohol consumptions happen through binge drinking, right, for teens. So teens consume 90% of their alcohol consumption through binge drinking. Let that set in. They're not as Ellen said, they're not going to have a refreshing drink. Like, they're doing it to get drunk. And so that's stuff that we have to think about as well.
I would love to chime in here too. And part of it is tying into what Michael just said, and also something that Terry said in the chat box that really goes hand in hand with what Michael just said, which is the parents' role modeling and how parents role model that we see that teens often are binge drinking, and they are drinking to get drunk. They are not having that, just glass of wine at dinner kind of thing. But also as parents, we have a responsibility to be role models and how we consume alcohol, how we talk about alcohol consumption, and what we allow in our home and in kind of our world and our space. And I mean by that if our kids hear us every day after work talking about, man, I need a drink, today was really hard, that sends a really clear message about why we drink alcohol. If our kids see us using alcohol as a crutch, as a medicine, as a coping mechanism, that they learn that that's okay. They learn that that's what you do and how you do it. We see this so much in social media posts and moms groups and, parent gatherings of who's bringing the alcohol and, just all of those kinds of messages about that how can you get through the day without a drink? Of course I'm going to have a drink tonight. All of those kinds of things. And I think that it is just really important that, and I think it is one of our challenges, is that it is so socially acceptable for us as adults and as parents to joke about, I need this drink. You don't know how bad I need this drink tonight. Of course we're gonna, all the moms are gonna go out together, and there's such an industry around giant wine glasses that fit a whole bottle of wine, and things like that just send this message of it is how you cope. It is necessary. And I think that's one of the biggest challenges of this work that we do, is finding that right space of, if you're over 21, make responsible decisions, drink in a way that is low risk for you, and low risk for those who are around you, but don't buy into this culture that that just perpetuates, ooh, I've got to start drinking, I've got to I've got to have that glass of wine in my hand to have a good time. And Terry just said to the panelists, one of her group's biggest challenges is kind of dealing with this without being the fun police. You don't want to, you got to strike that balance of, it's not about, I don't want parents to have fun, or I have a problem if an adult wants to have a drink or a beer or a glass of wine, but it's the messaging that we attach to that. That is one of our challenges when we deal with that from the prevention side. And it's something that as parents, we have to really monitor kind of what comes out of our mouth when we are with our kids, because it does send a message that they're listening to from the time that they're young.
Thank you all for those very thoughtful answers. Just hearing from each of you has really made me think about how even as someone under the age of 21, to see someone responsibly model drinking was something that I didn't necessarily see, and it wasn't as common. So that is, to me, that is one of the major things that I think everyone should kind of dwell on and think about. So at this time, I'm going to pass this over to Michael to kind of help me lead the Q&A portion. If you have not, please use the Q&A box to put in any of your questions that you may have for any of the panelists, or any general questions that you may have, any information you want clarification on. Please do so at this time. Also, please fill out the evaluation to get a certificate and resources, and to help us plan the next dialogue.
And we will continue on after this. We know that we're coming up on the hour mark. Some people might only have an hour to donate their time, and they might go back and watch this later, the rest of it later. So we're not done, we're still going, so don't leave. But please throw those questions in that Q&A box. If you don't know where that's at, it's right next to the chat button on your little screen at the bottom. So hit that, so we are going to answer it. So we already have 2 questions that I have. Ellen, you talked a little bit in the early on about a survey that youth take now. You said before the state did the survey, and there was a question about what underage drinking surveys are done. I don't know if you want to extrapolate on that, or if anyone else wants to add on to that.
Yeah, so the kids through school take the youth survey, and that's done all over the state, and they're asked a few questions. However, in Gwinnett County, we have an addendum survey that asks even more questions, because since we started the survey back in 1995, we have a history of questions that our providers and our community has been using to help measure our progress, or to look at where do we need to focus resources. And because we were doing it and can break it down by school and school cluster, that helps us too. If we don't have enough to cover the whole area, where do we need to concentrate our efforts? So you can go online and look at those survey results that your school, no matter where you are in Georgia, it's the Georgia Health Survey. It might be good to put something in the chat, Michael, about that link to the survey results. And then if anybody is interested in developing their own survey, just email me and I'll be happy to work with you. Unfortunately, the state doesn't ask all of the questions. They won't ask about, for example, teenage pregnancy, even though we have a high pregnancy rate in Georgia. And because of our relationship with Gwinnett Public Schools, we've been able to continue to ask those kind of questions. And there's correlations between substance abuse and other high-risk behaviors that we've got great data on, that we're able to access and help develop initiatives and strategies on how to address them.
Excellent. And in the chat box, you are getting a link to the Georgia Student Health Survey. And as Ellen said, you can get it down to a school level district, or you can get it down to an individual school with that as well. This question was asked to Ellen, but I'm going to open it up to everyone. And I think I'm going to start with Amara to start on this. But the question was, what do you think should be done to end underage alcohol, use? So, I mean, from the youth perspective, Amara, what do you think we can do, or what should be done?
Okay, so one thing I think that should definitely be done is every high school in Gwinnett County has clubs. I think that we need to start, as a student, I think that we need to start pushing our teachers to sponsor us in getting a club together that will advocate for the prevention of alcohol usage. And I think that with a club and with a group of students that can really get a number of people involved in their classrooms, I think it can really go somewhere, because a lot of people are scared. I know I was one of those people that was scared to say I didn't want to consume, or scared to stand up for peer pressure, or scared to stand up for being pressured into doing anything that I didn't want to do in high school, especially because, again, like I said, sometimes we often equate the popularity with giving into what people want us to. So I think that definitely when we start pushing our teachers and our administrators to help us get students involved in a club or an organization that can advocate for the students in the school, I think that'll definitely help a lot.
Excellent. Thank you, Amara. Lexi, do you want to add on anything?
Sure. I definitely agree with some of the things that Amara was saying. And especially after hearing Amara speak, I just feel like it just echoes already some of the thoughts I already have about reaching out to the teens, like some of the programs I mentioned earlier, GTI and the clubhouses. I feel like really working with the teens is key, because from what I remember, peer pressure was one of the number reasons why I saw some of my friends drinking and abusing certain substances. And I feel if there were more teens that were like Amara and other teens that are taking a stand and saying, this is not cool, there's other things we can do to have fun, or helping their peers that may have some type of home issues that may make them more prone to drink. If we have more teens that are helping with that, I think it could combat. Because just being honest, a lot of teens, when they have mentors or other adults that are speaking to them on things, that sometimes goes right over their head because they're not really in the space to really receive certain things from adults. I feel like sometimes when you have your peers, your friends you see them doing certain things, you see them avoiding certain things, and you see them advocating for certain things, I think that can make more of an impact at an early age.
Wonderful. Ms. Charmaine?
I would say the same thing. For our youth action team, we work with our students so that they will be able, mentor to them so that they'll be able to go back and then they mentor to their peers. And that is, has been a snowball, I would say, effect to really helping quite a few of the students that I have worked with, because they listen more to their peers for the most part.
Excellent. And Ellen?
I love all the creative ideas. I'm passionate about the role that parents play in helping to address this issue, because our research shows that parents are the biggest influencers on children's lives. And if parents would take a stand and be the parent instead of trying to be the friend, then we really could make a huge, significant impact on this issue. It's very difficult to be a parent in today's time. I'm a parent of a 36-year-old. It was not easy. I'm a single parent. I now have twin grandsons. There are so many competing interests for our children, and there's not enough hours in the day to be a good parent. I understand that. But you are what makes the biggest difference in their lives. And all the things that we've talked about on this webinar today are wonderful tips. And if you need more help, there's so many resources available. And I can't stress enough how wonderful Guide is to be able to help any of you address these issues. And they're more than willing. They have so many resources and there is so much help available. Don't hesitate to ask for help.
Yeah. And I think, Ellen, you bring up a great point. I think oftentimes when it comes to alcohol, people think about being the fun police with their kids and their teens. And I think if your teens out there throwing rocks at each other, you wouldn't worry about being the fun police. Or if they're hitting each other with sticks or in the head with a bat or something, you wouldn't be worried about a fun police then, right? And it's not about having fun when you make them clean their room or do the dishes or take out the trash. You're not worried about being the fun police then. But so many times with alcohol, we think, oh, I don't want, to be the fun police in some ways. And Jessica, do you have something to add to the conversation before we go to our next question?
I do, and I'm going to put a link in the chat box as well. There's this really great resource called Start Talking Before They Start Drinking. It's a federal resource. It is not something that Guide has created, but it is an excellent tool. And part of how I think that we've got to think about it is we often see parents who don't want to talk to their kids about any topic, whether we're talking about underage drinking or prescription drug abuse or vaping and smoking issues or whatever it is, because they're afraid. They're afraid of their kids asking them questions that they don't have the answers to. They're afraid of the kids asking, but did you do this? Because they don't want to tell them the truth. They just don't know how to have those conversations. And so they don't. Or they think, oh, my kid's not old enough for that yet. I don't need to have that conversation yet. But so often we see that young people are starting their journey with alcohol, their first taste of alcohol, between ages 10 and 12. So parents think, I don't need to have that conversation because she's not 15 yet. She's not 16. She's only 10. She's only 11 years old. But we can and we should be having these conversations as parents from the time that they are tiny. And we need to make it a normal thing. We need to make it a thing where we are watching a show together and we say, hey, there was just a whole storyline about kids sneaking alcohol. I don't think that that's okay. And I would expect that you would never do that. And, having those conversations, making those expectations clear, but doing that when kids are small. My son is 6 years old. And we have been having these conversations with him since he was old enough to understand what we were saying. And we talk about things that we see. We talk about what alcohol is. We talk about smoking. We do it in a way that is age appropriate. And that's a part of what that link that I put in the chat box can help provide. But I think that that's a huge place where parents have a real opportunity to not wait until kids are in high school. Because at that point, a lot of times they've already started drinking, they've already started using drugs.
And I think you bring up a good point, Jessica, with not wanting, parents don't know what to say when they were youth. And I was working with doing a training one time, and an individual that worked for an organization, and he was a youth serving organization, was saying, like, when they asked me, I don't want to lie to them, Michael, by telling them, no, I didn't use when I did use. But like, I got through college and I developed strategies so I could be successful while drinking and blah, blah, blah. And I said, well, you say that. But if you just said, but if I chose not to drink, I wouldn't have to develop those strategies. Like, you had to develop strategies so you could be successful when you're drinking. You put a barrier in front of you that didn't have to be there. And he goes, I never thought of it like that. And I said, and that's what you got to say. I had to do all these stuff. It made it harder for me to get this degree because I put a barrier in my way that I had to overcome, right? By not having the barrier, it would have been easier. All right, so excellent point. All right, Amara, my good friend Miss Veronica says, hi, Amara, you're such a brave young lady, and it seems like you can lead the charge for your peers to make the choice to not drink. Do you think that you, or have you, been able to persuade your peers to not drink?
Yeah, I actually have multiple times. I have had some of my friends be invited to parties, especially our sophomore year. I'm not really sure why, but there were a lot of parties happening my sophomore year. And one of the classmates that I had in my English class, as she was talking about her Sweet 16, she was just bringing up how her parents weren't going to be there. And that was all I heard from her. And as soon as I heard that, I was like, okay, there's a really good chance there is going to be alcohol there. And then one of my friends was like, hey, I got invited to this party. And I'm like, okay, who is it for? She was just telling him it was for this classmate. And I was like, okay, I already know there's a good chance there's going to be alcohol there. And all I want you to do is think about what would happen if you do something you're going to regret. What happens when you get behind the wheel? What happens if you get in the car with someone who's drunk and they get behind the wheel? What's going to happen when you're not able to control your actions because you're under the influence? Like, you have to think about those things because it's not going to be good for you. And you're not going to be aware of some of the stuff that you're doing. And that's such a scary thing to think about because we're young. You know, stuff goes on our record, and this is what people look at when we're trying to get a job. Like I said before, you have to really think about your physical and mental health as a teenager because it's so important going into adulthood, becoming of age. So I think that's one thing that I've always had to say to myself as well. What's going to happen if I'm not aware of my actions?
Amara, I'm going to have a follow up for you, Amara, as well. This will be your second year on our Youth Advisory Board, and Ellen's told us a little bit about how they're awesome resource. But tell us about your experience on the Youth Advisory Board, and what are some things that you've done in your 2 years through the Youth Advisory Board to advocate against both alcohol, but other substance abuse issues?
Yeah, so one thing I attended was the legislative breakfast this past year with a bunch of officials across Gwinnett County. And it was really cool because we were talking about big issues, not just regarding drug and alcohol use, but we also talked about climate change. And so it was really interesting to hear what our superintendents were saying, what our officials and what our leaders were saying in our community. One of the things that we talked about was being scared of being in school. I'm not sure if a lot of people know this, but over the past couple of years, students and schools as a whole have been getting threats about shootings. And we see this on the news a lot. And so we were able to have a really deep conversation about how scared it is, how nerve-wracking it is to just walk into a building and not know if we're going to be able to come home that night because of a threat or because of just a hunch that we have. So we were able to talk about that, and that was really cool. Also, just being out in the community, some of the other things that we've done, it's really nice to be able to talk to parents and young children, like kindergarten age. That's really nice and really cool because they find it fun, but at the same time, they're getting a learning experience out of it. So I just think that with being on the youth advisory board and with being engaged in a lot of stuff that we do throughout the community, it's really fun and really helpful for both ourselves and for people that are just trying to find out more about how they can be cautious of themselves and be cautious of their students who may or may not have peers or who themselves use.
Excellent. Thank you. Ms. Charmaine, you started Jared's Heart and you started a youth action team. So can you give us some of the highlights of what your youth have been doing in your community to address underage drinking?
Yes, we've hosted several, before the pandemic, we hosted several events where they were able to actively participate within the community. Usually, well, some of the things that they have done in the community is if there's an event going on, we'll sign up for it, and then we'll have a table, we'll have the literature, the materials, and then they actually speak as to the individuals that they see passing by, like may stop and ask questions when they see, oh, what you have going on here? And they talk to them about it. Some other things that we have done since the pandemic, we still actually host virtual sessions. So we had a campaign. We joined the Alcohol Free Gets Me campaign that you all actually host annually in April. And we were able to connect with students that was out of the country in South Africa. They joined us and participated in the Alcohol Free Gets Me. And that was where the students, you know, they were able to tell us about why they wanted to be alcohol free and what direction that they wanted to take in their adult life, you know, as they got older and went off to college and they didn't want to be alcohol free. So they gave, they participated in that and gave illustrations, and, you know, it was just fun. It was fun for our youth action team just to be able to communicate with people, not only here in Georgia, but actually out of the country to see what people are doing around the world. So that was really, really cool. So yeah, they stay engaged. And, you know, each month we host a session virtually and we open it up to the public to join, and they speak and give their opinions and their thoughts and talk about, you know, the consequences of underage drinking, why it's so important, you know, not to do it. So they've been really good. And we actually take what we get from when we participate during the summer with the other youth action teams as a group, and we all get together and brainstorm, you know, more ways of things that we can take from each other that has worked in their groups and then incorporate it and then roll it out in our community. So
We appreciate you seeing a need and stepping up and addressing that in your community that anybody can do if they see a need to do something. So thank you for doing that. And my last question before we go to the final question of the round, it goes to Alexandria. I call her Lexi. She told us to call her Lexi, so I'm sorry. Alexandria, one of the coolest things probably about your job is that you get to work with so many different providers on underage drinking prevention, right? Mm-hmm. So you work through multiple providers throughout the Metro Atlanta region. Is there anyone that you want to highlight, anything cool that we haven't talked about that you just want to say, here's another awesome campaign that's going on or awesome thing that's happening in the communities?
Well, I know with TCAT, I would definitely say one thing I thought that was cool with them was different advertisements they're doing on the different streaming services. I thought that was really cool because there's so many people now that are not really using cable and are really geared towards more using the streaming services like Hulu, Vudu, and Netflix. And I just thought that was really good for them to use that as a target because yeah, and then also with the teens, I know like from the teens in my life, that's all they're using. They're, you know, using the Roku TVs and using those services. So I thought that was a really good strategy in order to target some really good audiences and to target people that in a way, when people are, you know, in between their shows that they're binge watching, seeing different things, I know I pay attention to the different things that are being advertised in between. I know with like it was mentioned earlier, even with Guy, the different things that you guys are doing, the different I know Nikita stays on me with getting the different communications approved, and y'all have some really great ones. The most recent one I saw was the ones for the pencils, and I'm on them to get those approved, but which I know they will be approved. But I thought those were great because yeah, like in school, even, I mean, when the teens are able to get back in person, but even when they're not, I don't know if they'll be able to get them before they come back, but just even seeing different messages on everyday things you use, I think that's great, a great way to send out messages. And I think that some organizations, I think they take for granted how powerful different messages are. Even if you just see it and glance at it, those messages stay embedded in your minds. And I thought that was a great way. The window clings that you all are using, where you're thanking the different places for not serving underage drinkers. It may seem small, but I know that, like, from seeing how different retail businesses are, they take pride in, you know, being known for this or being known for that. So I thought that was definitely a great initiative. And I would say when I was in high school, I worked at a 7-Eleven, and there were a lot of people that came in there that were my age that were trying to buy alcohol. And the owner of the 7-Eleven, he took pride in, you know, people knowing, you can't come to my establishment and get this. You know, we're making sure that we're at least one entity in our community that's not allowing teens to drink. So I thought that was a great initiative. And there's so many things that the providers are doing that are so great. I wish I could highlight them all, but one thing I would say, I remember even with DPI, with Terry, when I first came on and met her, I noticed that they were doing so much work with the parents. And I thought that's great, because even though I do think that peer-to-peer mentoring is really great, yes, I do feel like there needs to be more support for parents too, because I don't think a lot of parents know how to talk. Like it was said earlier, they don't know how to talk about it. And even if it may, I think sometimes they may be more willing to, like, you know, chastise their kids once it's done, or, you know, punish them. But those things can be solved if you have a healthy dialogue and know how to talk about certain, you know, touchy subjects in a healthy way. So with DPI, with Terry, who's also on here, I just thought that was great, seeing all the efforts that they were putting in with the parents. So there's so many great things that the providers are doing, but those are some of the things at the top of my head I can think of. But yeah, it's been great, because for those that don't know, I'm fairly new to the agency. So coming on and seeing the things that they're doing, it was teaching me a lot about prevention and about how serious alcohol abuse is in the state of Georgia. So with underage teens. So that was definitely great for me, and the work that they're doing is awesome.
I love it, Lexi. And you really hit on taking the message where the youth are and saturating that message through pencils in their school, to their online streaming media, to their parents having support and education. So they're hearing it at home. It really is about that message saturation that we're all trying to get out there, and making our establishments, seeing it on the windows of establishments and things like that. I think all that's working. So I think that sets us up very well for our last question that I'll hand it back to Nikita for.
Thank you. So this question, I'm asking each panelist to talk for about 30 seconds to a minute. And as our audience is here and they've heard everything that you said, all of the great insights and perspectives that you've provided, but after all is said and done, what major takeaway do you want to leave the audience with? Ellen?
So the major takeaway is it's not hopeless, and there is a lot that can be done to address this issue in your community. So reach out, learn about it. We're all here to help educate and share resources, and I appreciate all of you being on the webinar today. Thank you.
And my major takeaway that I'm going to leave the audience with is that underage drinking can be prevented. We must all work together to educate our children on the prevention efforts and the effects early on. And we have to have the conversation. We have to have the conversation with our youth, our teens, and educate them on the consequences of making poor choices in school or college and how it can absolutely impact their future in a powerful way.
Thank you. Amara, did you have a takeaway for us?
Yes, so I would just say that a major takeaway for me would be, with all the resources that we have in our schools and our community, and being a member of Guide Youth Advisory Board, I think that this can definitely be pushed on our students in Gwinnett County to think about and really evaluate themselves on. So I think it'll just be a very, just a great way for us to really just get our students to pay attention to what could happen if they don't consume the positives of just being sober.
Alexandra, did you have a major takeaway for us?
I would say for me, one major takeaway, I think that everyone should just, keep remembering that this is the number one substance that is being abused by teens and underage at an underage level. And even though, it's other substances, like I said earlier, there's other substances out there that teens are definitely experiencing with. This is the number one. And it goes back to the other point that I brought up. I feel like it's heavily because it is legal. So that's why it's easier to access alcohol than it may be for other substances. But with everything that was talked about today, even though it is a terrible issue, it's something that is heavily affecting a lot of communities, regardless of race and socioeconomic background. There's so much work that's being done to combat it. And I feel like we have to do the work as public health professionals to go back and tell more people about these things. There's things I learned today from this panel that I would definitely share with other people, and just keep educating other people and making them know this is your problem. This is everyone's problem, and everyone needs to do their part and not just leave it to us or leave it to the people that they think are in charge of combating these things. And just making it, I guess, raising more awareness to make sure that it is not so much of a taboo, because children are doing it. Teens are getting their hands on it. They're having experiences with this. So it needs to be something we're talking about. So I think my major takeaway is this is the number one substance that's being abused in the state of Georgia. So it needs some more attention. It needs more number one attention. So that would be my major takeaway.
And Michael, did you have a major takeaway you'd like to share?
Sure. As I said, I'm the Associate Executive Director of Prevention. So I'm going to look at a whole prevention level of this. So if I didn't mention suicide prevention work that we did, it would be huge out there for me and a misstep. Join us in September for that community dialogue. But what we do know is substances, like we said, are sometimes substances or suicide or is a solution to a problem for a lot of times. So remember, it is the issue, but there's a problem. Why we need to get to the root causes of why this is. And we know in suicide work, there's a deadly triad. The deadly triad of someone that actually dies by suicide is that some kind of distress going on, a gun, access to a gun, and alcohol. It's not drugs, it's alcohol. And so what we got to say there is we got to keep on having these conversations. And if we can take one of those legs of that or sides of that, points of that triad out, we will help save. If we can take two, access to weapons and all that, even better, right? So we really want to look at this. This is, for a lot of times, this is a coping mechanism. And I think that goes back to what Jessica was talking about, parents teaching early on. Kids are always taking information. And early on, if they look at mama being stressed and she's like, I need this wine because I'm stressed and it'll make me feel better. What happens in their moments of distress? They will recall that memory of, well, this made mama feel better, so it's going to make me feel better. So I think it's looking at how we're mentoring, having conversations, and realizing that it's often a solution, and we got to hit those root causes too of why are they using.
Thank you. So I want to take a moment to thank all of our panelists. Thank you for your time this evening and sharing your perspectives and the work that you are all doing. I also want to thank all of the attendees. Thank you for being here this evening and listening to us just discuss something that is a huge issue in our community, and just ways that you can engage, whether it's through your work or through your relationships with youth. We do have a few reminders, and I'll allow Michael to give those. But more importantly, could you please fill out our evaluation to get your certificate and resources and help us plan the next dialogue.
Yes, thank you all for being here. We want to thank the audience and anyone that's watching this afterwards. Thank you for taking time, because by engaging in this conversation, it's going to be a way of combating it. And I think if people stop, and we sometimes talk about, like, people don't want to talk, as Ellen said, about underage drinking because it's not the sexy topic at the moment, you know, and stuff like that. Although I do want to remind you, we are doing these community dialogues. Our first one was last month. Jessica led a great, with Laura Bracke from American Heart, led a great conversation about vaping. And next month on August 13th, we have a community dialogue around opioid and prescription drug abuse prevention. So we invite you to please put that on your schedule, again at 4 to 5:30, and keep on. And in September, we're going to have one around suicide prevention and mental wellness. So we want to continue having these dialogues with our community. You're all invited. Please fill out our evaluations and let us know how we can do better. And if we at Guide can do anything to support your efforts or to give you resources, and Ellen's already put her email in the chat, please reach out. We are more than willing to share and have conversations with you. But with that, that will lead us to the end. I pray that you all take great care and keep washing those hands and sanitizing and wearing those masks and everything that you want to do to keep yourself safe, whatever that looks like for you. So thank you and have a great night.